Hi, how are you doing today?
I'm well, how are you?
Good. My name is Sandra, and I'm going to be doing a musculoskeletal assessment on you today.
All right.
Do you have any questions?
No.
Okay, so we're going to start with some wrist tests. These are tests usually done for carpal tunnel syndrome. I'm going to start with the Phelan's test. Okay, and for the Phelan's test, I would have you join your wrists together like this and hold it for 1 minute. If any tingling is felt on the index finger, the middle finger, or thumb side, or pain as well, that could be a positive sign for carpal tunnel syndrome. Okay. And do you feel any pain or tingling?
No.
Okay. The next test is called the Tinel test. Okay. So what I'll have you do is open your arm like this, and I'll just start tapping from the index finger down to the elbow and also at the wrist. Do you feel any pain or tingling?
No.
Okay. If pain or tingling is felt on the thumb side, the middle finger, or the index finger, that could be a positive sign for carpal tunnel syndrome. Okay. Next, I'm going to look at the elbow. I'm going to inspect for any redness, swelling, or deformities. I'm going to palpate the olecranon process. Then I will do the palpate the lateral epicondyle and palpate the medial epicondyle. All right. And can you flex your arm for me? Extend. Okay. Pronate. Supinate. Okay. And I will do the same thing for the opposite arm. So that's basically the elbow. Next, I'm going to inspect the shoulders to see if there's any swelling, deformities, or redness. I'm going to start by palpating the clavicle, the AC joint, and the acromion process. Do you feel any pain?
No.
Okay. So next I'm going to do some shoulder tests. I can have you stand up. Okay. So I'm going to have you flex, extend. Okay. I'm going to do abduction away from the body, adduction back to the hip. Then I'm going to have you internally rotate and external rotation. Okay, so shoulder positionings are within the defined limit. Okay, next we're gonna observe the back. Okay, I'm gonna inspect the back for any redness, swelling, deformities, just anything out of the norm, and I'm gonna look for scoliosis. So a way that they test for scoliosis is I'll have you bent over, and I'm gonna observe the shoulder blades. If I see one shoulder blade is higher than the other, that can be a sign of scoliosis. Next, I'm gonna take my finger and I'm gonna walk down starting from C7. I'm gonna walk down the vertebrae. Okay, and you can stand back up. Did you feel any pain?
No.
Okay, so a negative sign of like if there's any pain or muscle spasms at the disc, that could mean, or on the vertebrae, that could be a negative sign that there may be something abnormal going on with the spine. Okay, and I'm going to do some range of motion tests. I'm going to have you bend forward, flex, and back up. That's extension. I'm going to have you do lateral bending, and I'm going to have you twist. Okay, so we're going to do a few more back tests. I'm just going to have you lay down on your back across the couch. So with this one, I'm going to ask you to dorsiflex your feet towards me, like flex your feet towards me and meet resistance. And do you feel any pain anywhere?
No.
Okay. If she was to feel any pain, specifically along her back, that could be a sign that there may be some disc impairment at L5 or S1. Okay. Okay, and the next test is called a straight leg test. So I'm just gonna have you lift up your leg. And do you feel any pain? Okay, if she were to feel pain radiate down the back of her leg, that could be a sign that there may be something wrong with her vertebrae disc. So next, we're gonna do some hip range of motion. Okay, so I would start by inspecting her hip for any signs of swelling, redness, or deformities. Now we're gonna do some range of motion. I'm gonna have you flex your leg up, okay, and back down would be extension. We're gonna do abduction to the side, and then back to the side is adduction. Okay, if you could do those moves without me helping, okay? Abduction, adduction, flexion, extension. And now I'm just gonna have you rotate your ankle inward, that's internal rotation, and outward, external rotation. Okay, thank you. Just gonna make sure that, all right, they can see. Okay, and those are the hip movements. Next, I'm going to do the knees. So first, I would just expose, one of your knees, if I can, yeah. I'm gonna expose one of your knees. I'm gonna inspect the knee for any swelling, redness, or deformities. I'll palpate the patella, the patellar tendon, the tibial tuberosity. Next, I'll do the medial joint line and the lateral joint line. And do you feel any pain? Okay. Now I'm gonna test for ballottement. So what I would just do is I'll take my finger and I'll press. And a positive sign for ballottement would mean that there is knee effusion or effusion occurring inside the knee. Then the next test that we're going to do is called the Varus test. So with this one, it's going to check for if there's an injury at the LCL. So what I would do for this test is I would, you can keep your legs straight. Push laterally, and if there's any laxity felt, that means that there's possible injury at the LCL, or if there's any pain felt. Did you feel any pain?
No.
Okay, and I didn't experience any laxity. Next is the valgus test, and that's done to check the MCL. So it's the same thing, but this time I would switch and push medial. Okay. And did you feel any pain?
No.
Okay. So if there's any MCL laxity or pain felt, or if I don't experience, or if I do experience a give, that means that there could be a MCL injury. Okay. The next test is going to be called the anterior draw test. So this one, I'm just gonna ask you to bend your knee. I'm gonna sit close to the foot. Take my hands, and I'm going to push towards me. Okay, did you feel any pain? Okay, and I didn't experience any laxity. So if there's any pain or laxity experienced, or if it doesn't give, that could mean that there's an ACL injury. Now I'm going to do the posterior draw test. Same thing, but I'm going to push towards you this time. Did you feel any pain? Okay, so if it didn't give, or if there's pain felt, that could mean that there's a PCL injury. The next test that we do, called the Lackman's, is also for the ACL injury. Is I'll just have you about 30 degrees, and then I have a hand on the femur, and then I'll push. Do you feel any pain? Okay, if there's any pain or laxity felt, that could mean ACL injury as well. There's no laxity, or if it doesn't give. And then the last test that we do is called the McMurray test. A positive McMurray test means that there is a meniscal injury or injury at the meniscus, and this will be given if you feel pain, or if you hear a clump or a clink while doing this test. Okay, so what I'm gonna do is I'm gonna take your knee and I'm gonna bend. I'm gonna do inward too. And did you feel any pain?
No.
And I didn't feel or hear any clicks. And so her McMurray test was within defined limits, and that concludes the musculoskeletal test.